Today is a very difficult day for our state.
36 lives lost in New South Wales. Nationally, the deadliest day of the pandemic so far, with 77 deaths recorded.
We have to live in the world as it is, not as we want it to be. And as we've moved through this wave, sadly, we will see more deaths. That is the difficult reality of the pandemic.
Despite the growing death toll, the Premier confident his state will cope.
We're seeing other states who don't have as many cases as we have in New South Wales already using their hotels as hospitals. We're not doing that.
Other states, like Victoria, which is now at breaking point.
We've got more than 4,000 healthcare workers unavailable right now. Vast number of patients, an extraordinary workforce that are absolutely exhausted.
For the first time ever, the government calling a statewide Code Brown.
We could well get to over 2,500 hospitalisations and more, and now is the right time to act.
The measure, usually short-term and reserved for natural disasters, means hospitals will be allowed to cancel workers' leave and redeploy staff to areas of highest priority.
This is something that we have been planning for.
A move to preserve a buckling healthcare system, a system that's being misused.
We had a patient last week, they called 000 under the guise of having chest pain and were fast-tracked down to a resuscitation room, at which point they declared that they didn't have chest pain and they really wanted a PCR and wanted it quickly. That is an unbelievable misuse of resources.
The federal government coming to the state's aid this afternoon, drawing staff from private hospitals to boost the public system.
The private hospitals agreement will see up to 57,000 nurses and over 100,000 staff made available to Omicron affected areas around the country.
So as Victoria battles on, will it be enough to stave off an impending healthcare catastrophe?
Well, Dr Stephen Parnas is an emergency physician in Melbourne and he joins us now. Dr Parnas, will Code Brown hold the system for what we know is coming?
It'll enhance things, Carrie. It will improve our capacity. It will redeploy that most precious of resources, which is staff. And I think it will help the wider community understand that we have to prioritise as we go through the worst aspects of this wave.
So much pressure on you all at the moment. How are you and your colleagues going?
Oh, it's tough. I think there are different levels of stress. The people who are out either with COVID or as close contacts feel a sense of guilt that they can't be in there helping. There are others who are very tired and would rather not acknowledge it. And many of us are doing our bit and looking at a shift by shift approach, a week by week approach. We can't really look beyond that because it's just it's too hard to look beyond the next couple of weeks, really.
Hey Doc, the federal government has said they're going to use private staff to help boost the public sector. Is that going to be enough?
Well, it'll be welcome to enhance capacity. The question, I think, really is how will that happen in practice? How quickly can those boots be deployed and how can we involve our colleagues in areas where it is unfamiliar for them, whether it's a new building or a new specialty or things like that. But it would certainly be welcome if it can be deployed rapidly.
Stephen, we've had 2 years of being told to fear every case and always seek help. And now with high levels of vaccination, we're transitioning to a new phase of the pandemic of more managing the disease. This is a big change for Australians. You know, is it a big change for us to have to make?
It's a rapid and very difficult change, I think, Sandro. The lessons, the messages we were told for much of the last 2 years are redundant in a much more infectious virus that we can't eliminate. And so the challenge is for people to cope with that stress and absorb the new messages about how to manage this so that they don't feel alone and that they feel appropriately supported, however stressed the health system is.
Stephen, New South Wales has twice the number of hospitalisations but hasn't had to call a Code Brown. Why is that?
Well, I think the principles are the same whether you're north or south of the Murray, Lisa. The fact is that New South Wales has, I think, just as much pressure, if not more, than Victoria does. Their staffing is facing critical shortages. Whether they call it a code brown or another code or not, the fact is that they are having to scramble to try and boost capacity, to prioritise and to have things that are less urgent just have to wait. I don't think Premier Perrottet crowing about Victoria using hotels really adds much to how a stressed community deals with this wave.
The number of deaths today, Stephen, was devastating, 77 across the country. How much higher do you expect those numbers to go?
Oh, it's a number that no one wants to see go up, but it will continue. It just demonstrates that that this is not a flu, that this is a serious illness, that the last number to go down actually will be the numbers of deaths, because these are often people who have been in hospital in intensive care for weeks, or someone who is frail, who has not been able to withstand aggressive treatment and has died relatively quickly. Behind every one of those individuals is a family, and it is, I think, constant incentive for us to make sure we have capacity to give the best possible treatment with the resources and people that we have.
Absolutely. Dr. Stephen, we appreciate everything you're doing too. Thanks for your time.
Thanks very much.
And what he just said then is so true, the idea that behind every one of these people is a family. I was watching someone today earlier comment on the idea that if this was a natural disaster or some big event that happened on a day, those faces would be plastered across newspapers and everywhere. All these people that we've lost in a single day here in Australia, but yet every day now it's just a number, and it's not just a number. And this is a lot of people now daily, and he's saying it's only going to go up.
Yeah, I also think it's really hard when you talk about the staff involved. I mean, one of my friends is a nurse, and she's been working on COVID ward now for close to kind of 18 months. And so when you hear things like the code brown and its leave being cancelled, it's people that are already at breaking point. And the danger is they're just going to walk away from their jobs.
I know.
And I hope that we don't forget this. I hope that, you know, whenever we're on the other side of the pandemic, we realise that we haven't treated our healthcare workers good enough for a long time, and I hope that is at least a change that we implement.
But I do also think, I mean, the Code Brown is about preparing the healthcare system. My partner works on the front line. I was a doctor. You know, I think this is a sign that the government is taking the measures. They know that wave is coming. There is a delay always between cases and hospitalisations, and even worse. With that coming, they're preparing the system. They're putting the things in place, greater coordination, greater support, and they're calling that a name to show, you know, a clear signal that this is something that is a big focus. It's a code brown. And I just want to say, if there are viewers who find themselves in a true emergency, please never, ever delay calling 000.
And Doc, in hindsight, are we happy with the colour? Are we happy that we've gone with brown for what is such a serious issue?
You don't need to answer that, Sandro. The rest of Australia agrees that brown is exactly the right colour.